Hello and welcome to the weekly Dementia blog. My name is Dr. David Hutchings. These are being sponsored by SpectrumMed as always. Sorry we missed you guys last week. We had a week off there, but we are now back and we're actually going to conclude the series on what to do after the diagnosis of any form of dementia. Next week we're going to be talking about facility placement once we get to a certain stage. What are the steps for us, especially with the pandemic going on, which has really impacted facility placement for patients. So we're going to talk a little bit about that next week. So wrapping up, we got a lot of hits on the how to actually do the diagnosis itself, the steps that we need for an official diagnosis. So let's kind of recap in terms of what, now we have the diagnosis. We've been talking about this over the last, I think, 5 or 6 weeks now. So now what? Number one, making sure that your loved one knows that he or she has a memory or cognitive issue or problem. I will kind of speak out two sides of my mouth on this. I think that's a good idea if you're in the very early stages, but if we're in the middle stages, that may not be the best idea. So kind of keep that one based on stage. Next, I think is very important is making sure that we seek out elder care for long-term care insurance and making sure we look at our assets because as the disease moves forward, obviously it can be very expensive from a monetary standpoint. Number three, making sure that you have time off is as we start to also investigate well-trained sitters to come in and help you, but you also as a caregiver to decrease some of that caregiver burden, we have to have some time off there. I think it's also very important. Many of you have heard me speak for the Alzheimer's Association. I have another lecture for the Alzheimer's Association coming up on November 17th. So I'm a huge fan of the support groups when I participate with those a lot. So making sure that you get yourself into a good Alzheimer's support group or some form of dementia support group. I know Vanderbilt has a frontal temporal lobe dementia support group. So definitely that can help you and be around other people that are going through the same journey. Addressing driving safety, it would be the next one, making sure that we are looking at the family accounts and making sure that we also are making a detailed list of our health information, our medications that we're using, and also looking at some of the home modifications that we'll have to look at in the future as the disease progresses. And we can have caregivers come in, but I think it's also, you've heard me talk many times about home health care. So skilled nursing, physical, occupational therapies, and speech pathologies can really help with the home modifications and also dealing with the patient's safety as well as decreasing the caregiver burden as well. So and the last thing I'll say too is learning to love your loved one in the now. We've talked about this before that this is a disease, and so we know that this is not the person that we have known for so many years and been around with for so many years, that we are dealing with a disease. So it's easier said than done to do that, but every single day, if you're already a caregiver and you're watching this, you know exactly what I'm talking about, that every single day is a challenge. Every single minute is a challenge when you're trying to care for a loved one who has dementia. So learning to love the person as they are in the now. So we've covered a lot of information over the past, again, 5 or 6 weeks on what to do after the diagnosis. Keep the emails coming, keep the questions coming. Use those to help drive our next topics for the next week. So again, next week we'll be discussing facility placement and when do we do facility placement, when is too soon, when is too late. So we'll be talking about that as well as what to look for in a memory care facility for your loved one, whether it's memory care, even assisted living facilities as well. So I'll be talking more about that. Again, thanks for tuning in. Keep the questions coming, and we will see you all again next week. Thank you.